Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, your practical voice in a world of confusing health information. And we're coming off a series where we talked all about immunity and immune health. If you missed that one, go back and check out those last 4 episodes. We covered everything from the organs and glands that are part of the immune system, how they work, how to influence them, how to make them stronger, how to make them better, how to make your overall immune system and health that much better. And we're going to dovetail that with this month's series. We're going to do a 4-part series on lowering stress. Even though we've done that before, we're going to take a totally different approach this time to lowering stress. And we're going to take it from the standpoint of looking at how you can influence your nervous system to actually lower stress, because stress ultimately is about your perception of it. Meaning, for example, that if two of us went skydiving and we both jumped out of the plane, the event that is happening is exactly the same for both people. However, how we actually perceive it differently will determine the level of stress that we experience. Like for one of us, it may be the most exciting, exhilarating, amazing, positive stress moments in our lives and actually bring us a lot of joy and just a really amazing time, where another person might have a heart attack by the time they hit the ground because they're so scared or in fear of something wrong happening or whatever that you want to say. So when we look at it from this perspective, one of the things that we must look at is we must look at what is called the vagus nerve. And don't get so stuck on that right now, but just know that you want to hang on to the next 5 minutes that we're going to cover, because we're going to talk about what the vagus nerve is, why you should actually care, and what it controls not only in your body, but also how it influences your ability to lower stress. Now, my first question is, have you ever heard of the vagus nerve? Chances are, unless you've taken a deep dive into anatomy class, into the cranial nerves, then probably not. But scientists have actually researched many, many functions of this nerve, and it's ongoing all the time. They still have so much work to do in this. But on this podcast, what we're going to do is keep it super simple, like we always do. Very practical, but really all about this very special cranial nerve that we have. So the body has 12 cranial nerve pairs that help link the brain to different parts of the body, such as head, neck, torso, and so on. But some of the cranial nerves help with what's called sensory information, including things like sight, smell, sounds, taste, and communicate that back to the brain. And this is called what we call sensory function. But then other cranial nerves control parts of certain nerves to various muscles. And this is called motor function, like your ability to move and know where you are in space, those kinds of things. However, some nerves perform both sensory and motor functions, and a good example of that is the vagus nerve, which is also called cranial nerve number 10. Now, the word vagus in Latin stands for wandering, and that is an appropriate name for this particular nerve because the cranial nerve, it wanders from the brain into the organs of the neck, the abdomen, the chest. It's the longest and the most complex of all of the 12 cranial nerves, having 2 bunches of sensory nerve cells. Basically, it allows the brain to monitor and receive information about so many different bodily functions. The vagus nerve starts in what's called the medulla oblongata. You don't need to know that. That's in the brainstem. But if you remember I can't remember the name of the movie with Adam Sandler where he played the football player. It was Waterboy. That's what it was. And in Waterboy, he was in class and then he was stuttering. And then the teacher said, "There's something wrong with your medulla oblongata." So basically saying something was wrong with his brainstem. But I digress. But really what it is that the vagus nerves have 2 really long nerves, long fibers, having these small cells that carry information around the body. One nerve emerges on the left side, the other one comes out on the right, but from the medulla, the vagus nerve goes down and all around the body. It goes and controls the muscles of the larynx, basically your voice box, and moves up to reach the inside of your ear and from the back of your throat down to the large intestine. Different parts of the nerve wraps around various other organs and areas, and it sticks delicate fibers actually into the heart and even goes all the way down to touch the bladder as well. So, what does the vagus nerve do? A variety of different functions. However, I'm going to give you a few of its key functions, even though there are many, many, many more. It senses information from the heart, throat, abdomen, and lungs. It provides taste sensation. Behind the tongue. It supports movement functions of the neck muscles responsible for speech and swallowing. It's responsible for respiration, the digestive tract, and heart rate functioning. It delivers information from the gut to the brain relating to anxiety, stress, and fear, hence the common saying of what's called a gut feeling. There is no gut feeling. There is your vagus nerve communicating from your gut to your brain, and it communicates with the diaphragm during deep breaths, and then that's how the vagus nerve also can influence your ability to calm down through breathing exercises, but it also sends anti-inflammatory signals to other parts of the body. So if the vagus nerve is overactive, your heart may not pump enough blood around the body, and sometimes it can cause organ damage and loss of consciousness, known as what's called a vasovagal response. You can look that up, vasovagal response. Basically, the person just passes out. But again, you can learn more about that on your own. And why should you care? Like I said before, the vagus nerve plays a huge role in our overall health and wellness. However, research has shown that chronic conditions such as diabetes, alcoholism can cause damage to the vagus nerve. And if the vagus nerve is damaged, it may result in diarrhea, bloating, nausea, gastroparesis, lack of being able to handle stress, and a whole host of other things. But that's just more of a reason why you should learn how to strengthen the vagus nerve naturally. So today was just an introduction. We are going to be giving you so much more on the vagus nerve, how to influence, how to make it better, how to make it stronger, how to make yourself healthier through really super simple things that you can do on your own at home to influence the vagus nerve. So again, this is Dr. Jason Jones signing out. Hope you got something out of this podcast. If you did, head over to our Facebook page, give us a message, and we look forward to seeing you on the next podcast. See you later. Bye-bye.